Guillain-Barré syndrome cannot occur on its own. This is page 2103, chapter something. Chapter 64. I repeat, it cannot occur on its own. Let's start with the pronunciation. It's Guillain, okay? It's not Guillain-Barré. It's Guillain-Barré. So it always sounds better in French, like ménage à trois.
How is it?
So the condition, again, it cannot occur on its own. There's always a precipitating event. The most common precipitating event is a viral infection or bacterial infection from Campylobacter jejuni, or from viruses like the cytomegalovirus, Epstein-Barr, Mycoplasma, Zika, or in some cases, it also happens after a flu vaccination. Okay? So it's an autoimmune disorder precipitated by the following, as already mentioned, meaning the patient had any of these events, including a recent flu vaccination, and they developed this autoimmune attack. Do you remember myasthenia gravis? Okay, so the myasthenia gravis, that was also autoimmune, correct?
Yeah.
Okay, so and then the treatment was immunoglobulin and plasmapheresis. Same exact thing here. So this one is ascending paralysis is the feature of this disorder. So again, it's autoimmune in nature. The patient gets a acute rapid segmental demyelination of the peripheral nerves and some cranial nerves. So the pattern is ascending paralysis. The patient was fine yesterday. Today they wake up, they try to stand up, and then they fall on the floor because the legs are weak. And then it starts weak and then becomes paralyzed over the next few days.
What can you do?
Okay, very good question. So again, because it's autoimmune, we don't know exactly what causes it. We just know from the history, the patient either had a flu shot or had a recent viral infection, the viruses we had mentioned earlier, including the bacterial infection, Campylobacter. No, it's not one of the causes. So there is demyelination of the peripheral nerves here, resulting in, the patient is not technically paralyzed, but because there is demyelination, so can the nerve impulses travel? No, the nerve impulses cannot reach beyond the demyelinized region, resulting in weakness or paralysis. So it always starts from the feet, from the toes. So there's a saying, it starts from the toes and up it goes.
What's the way that?
Okay. The patient becomes paralyzed eventually. And what will really hospitalize the patient is if it reaches the diaphragm, in which case the patient can no longer breathe and will have to be intubated. So the course can go gradually from 1 to 3 weeks. The window for treatment, because we can shorten the duration of the attack if the patient seeks help within the first 2 weeks of from the onset of symptoms. What are those two treatments again I mentioned earlier? Immunoglobulin infusion or plasmapheresis. Okay, it's or. You can't do both, not necessary. I mean, why would you do both? Okay, each one is effective. The cost is different. Oh, which one is more expensive again? The IVIG is expensive because it's sold by the gram and the dose is based on your weight. So the higher your weight, the more you need, and it's about $1,500 per gram. So that's a lot of money. And it's not like a one-time infusion. Okay, it's a series of infusions, at least 3 a week, every other day infusion. And the goal only is to shorten the period. However, some patients may go on to develop other polyneuropathies, which go beyond GBS. We had a when I first started here, 2015, I think 2017 or 18, one of the instructors developed this. So she had a flu shot 2 weeks before, and then she developed it, and then because she teaches the course, so she recognizes it, because it's not common. It is not a very common disorder. So she recognized it from a recent lecture, and then she went to Presbyterian, and then she was given immunoglobulin, and then she improved. So it was a positive diagnosis, okay, because she responded well. However, a month later, as she was recovering at home, she developed the symptoms again. So this time it can't be GBS anymore. She just had it recently. So she was diagnosed with some type of polyneuropathy. So she's now permanently in a motorized wheelchair. So that's why she stopped teaching. He was a very good teacher. In her case, it was the flu shot. That was the only one she had because she didn't have the flu. She didn't have Campylobacter. She was negative for any other infections.
So why is medical facility advised to take it even though they could be respect?
Again, it's very rare. I mean, it's not like every person develops GBS.
It's off topic, but the flu vaccine, it has a thing that when you say you're gonna take it, it says that there's no liability to the company, right?
Yeah. So when you sign it, it's actually in there. If you bother to read the fine print, GBS is mentioned in the paper you sign.
I think it is.
So again, if the patient, so what will delay treatment and therefore miss the window, and then we fail to shorten the period is yeah, no insurance, or let's say the patient is self-medicating, for instance, or they're just it's nothing. Okay, so that will incapacitate the patient, and then eventually they'll come and then get intubated. Okay, because we can't stop it anymore. So the key here again is what's the period? Within. Okay, so here, because it peaks within 2 weeks, therefore, if you seek treatment and get the immunoglobulin or the plasmapheresis within that first 2 weeks, we don't have to deal with the diaphragm paralysis. Okay, so you don't need to be intubated. Right. Other manifestations are really, and management is really supportive. So besides the immunoglobulin infusion and the plasmapheresis, all the other interventions are supportive. Because is this patient bedbound now? Yes, because they're paralyzed or very weak. So we prevent pressure ulcers, prevent blood clots. IVIG, the only responsibility you have here is during the infusion, they may have an anaphylactic reaction. Okay, that's the only known adverse effect of IVIG. Plasmapheresis. So let's review. So when you do plasma exchange, what are the 3 things in plasma again? No, 4 actually. Clotting factors. What else? No, this is plasma. So we removed all the blood cells already. Albumin is in there. It's mostly water. And then what's the last thing in there? Which is the whole point of doing that procedure here? What is this condition? Caused by autoimmune, right? So therefore, what are we removing? The antibodies. Okay, right. So there are 4 things in plasma. So you got water, albumin, and clotting factors, and your antibodies. So that's why we do the plasma exchange. Other interventions beside these, We support the patient, especially if the patient does end up intubated. Then we'll talk about mechanical intubation and airway management in for exam 3. Yeah, the rest here are supportive management. Again, the preventing complications of immobility, supporting oxygenation and ventilation. If we get to that point. And the patient typically is either given altered consistency for the diet, if they're even given a diet. But once there is already mechanical ventilation, of course, that means the bulbar muscles, but muscles involved with chewing, speaking, swallowing are now affected. So therefore, they'll have a feeding tube. So we'll put in a nasogastric tube, and that's how they get the nutrition. And then the rest will be physical therapy, speech, swallow, communication, because speaking will be difficult again because of the bulbar muscles involvement. So they'll use a Ouija board to communicate. A communication board. Isn't a Ouija board a communication board?
Yeah.
Yeah, technically, yeah.
Technically, yes.
Like I said, so all of these are supportive, say beginning from nutrition, improving communication, decreasing anxiety, because this is scary, right? I mean, you would think, oh, will I be paralyzed forever, right? This will change. This is scary. I only seen one GBS patient, and this guy was over 400 pounds. It's very difficult to, I don't know, even I don't remember why we got him up in the first place. I don't know whose idea that was to get him out of bed. I remember it was a physical therapist. He was trying to do the eval. I hated that guy. 450 pounds, getting him out of bed.
Was a whole staff there trying to help.
About 3 of us.
You guys must be really strong.
That's it.